Hi, and welcome back to the WHY-O-MYO podcast. This is Janine Stiene, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy.
Disclaimer. All content, details, as well as education shared on this podcast are the opinions of the speaker and are for informational purposes only. Please consult with a certified medical professional regarding any questions or concerns, as this podcast should not serve as a diagnosis or replace the information received from a healthcare provider.
So I wanted to spend today talking a little bit about what some myofunctional therapists call the cave, other myofunctional therapists call it the pull, but ultimately it's the contact between the tongue blade and hard palate. And the importance of that contact, especially from an early age, is to help shape the hard palate to fit the tongue exactly, just like a puzzle piece. So the tongue should fit perfectly within the hard palate without any overlap onto the dentition, any thrust through open spaces. So the tighter the pull or the tighter their cave means the more contact you have between the tongue blade and hard palate. And being that we're working towards eliminating an infantile swallow pattern and we're working towards moving them into their adult swallow, we need to consider what it means when we get past purees or we get past even stage 2 baby food. But once we get to stage 3 and then solids where the individual, your patient, your child needs to manipulate by chewing, as well as creating a bolus or a ball of food prior to swallowing, that bolus or that ball of food that they create from using a rotary chew and lateralizing side to side, that ultimately will be what sits on the tongue blade. And when you swallow utilizing an adult swallow, that contact becomes imperative because it means the tighter that contact between the tongue blade, the bolus, and the hard palate, it means the better the patient or the child will be able to clear their chewed food without a significant amount of residue. And for many tongue thrusters, they may not thrust on their first or second swallow, but it's because they're not getting good contact of their tongue blade and hard palate that it's allowing for a significant amount of food or any amount of food to fall out the lateral margins of the tongue and get stuck in the cheek or buccal cavity or leave residue on the hard palate or tongue blade. So we really want that contact to be as tight as possible. And sometimes, especially when we're talking about chewed food, sometimes as a compensatory technique, we have to start by giving our patients or our children smaller bites so they can make a smaller bolus so that it's not compromising how tight that contact is between the tongue blade and hard palate, or the middle of the tongue and the hard palate. So we want to give the patient the ability to be the most successful, swallow without a thrust, and limit how much residue remains after that swallow. And as I said, sometimes we need to utilize a compensatory strategy of a smaller bite, which then becomes a smaller bolus as the patient is getting better or as the patient is improving their adult swallow. And sometimes we don't have to keep those smaller bites and those smaller boluses indefinitely. Sometimes it's just to start the patient and to get them comfortable with swallowing and maintaining that contact. But for others, it's a long-term modification that we need to make. And that long-term modification is going to make all the difference when it comes to having your patient swallow without a thrust, and not giving them the opportunity to thrust on all of those subsequent swallows that would normally occur secondary to residue falling from a compromised or weaker contact of the cave or the pull, and allowing too much freedom for that food to fall and do what it wants to in the mouth because it's not being contained tightly in that contact between the blade and hard palate.
I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.